Good evening, ladies and gentlemen, and welcome to the Season 1 finale of Battling and Beating Cancer here on CAN TV. I'm Scott Seaman. I know I've been the site for the cause of a lot of sore eyes here in the Chicagoland area over the past 13 weeks, but thankfully we have Charlene McMann, who has been a site for sore eyes. We're both co-founders of the Chicago Blood Cancer Foundation, and of course Charlene's actually fairly prestigious, being a Jefferson Award winner, being a former Chicago Woman of the Year First Prize winner, and being somebody that has helped so many people over the years with not only blood cancer but all forms of cancer. Charlene, welcome to our final show of the year.
Thank you, Scott. Good evening, everyone. Cancer, we're going to talk about cancer. This is our last show again, and Chicago Blood Cancer is committed to curing lymphoma, leukemia, and myeloma. We want to raise awareness, promote education, and help people impacted by the cancer. And of course, we've had some good guests on our show, and
we've had some fabulous
guests, telling everybody about cancer, lymphoma, leukemia, and myeloma. And of course, we love Rush University Medical Center, so we have a terrific guest tonight. But if you are impacted by blood cancer and need information, please give us a call at 888-792-9992, and you can reach us at www.chicagobloodcancer.org. And we understand that cancer is the most it's the most terrible thing of our TV subjects, but we have to talk about it.
I mean, it's not like, watching a good football game or watching a good comedy show.
Or a cartoon or anything, but we do have to talk about it because so many people are impacted by it, and so that's what we're here to talk about. And we hope that we have helped you, find out some information on blood cancer, the different types of cancers. And we will be joined tonight by Dr. Stephanie Gregory, Professor of Medicine and Director of the Section of Hematology at Rush Medical University. She's not only a fabulous person, but she is one of the top hematologists, oncologists in blood cancer in I would say in the world. Would you say that?
You would be right. She
and
is
I would
the
say
very
the
best.
world, yes. And we're going to have her talking on tonight. And what I'd like to do is just, hit a few things on cancer tonight in our cancer segment. And one of the big things I am is a checker. And
she is a checker. She double checks the door, make sure it's locked before we go to bed.
Because you don't lock it, and I always find it unlocked. So I always find that you're wrong and I'm right. That's how we get along in marriage, which is what we...
When I would say to that, yes, dear.
Yes, dear. That's how you learn. So anyway, checker. And when I say checker, what I mean is check everything when you get a diagnosis, and again, he'll say check your doors. Well, I'm saying check your, the doctors you go to, the hospitals you go to, check your medications they give you, check everything you can. Be your own, best person as far as following up on what you do with cancer, because it's your life. And it's very important that you take control of the situation. And I know it's very devastating when you get a cancer diagnosis, but have, your family members, like I did with Scott. I kind of took control and, make
she
sure
always takes control.
I take control. That's my job. So, but, it's very important that you check everything you do and get second opinions. And I can't say that enough. I hear so many people that go to one doctor, they just go with it. And there could be other treatments out there that you don't even know about. And so you're missing out on, and this is your life. So make sure that you get the right treatments. And I'm going to turn this over I wanted to say one thing. You want to say something about our bike ride?
Well, sure. We thank everybody who came out a couple weeks ago for our Out for Blood team and our bike ride. We raised some money, we raised some awareness, but we're not done. And you can continue to reach out to us at chicagobloodcancer.org, make contributions, qualify for a jersey. All contributions received until the end of the year will go towards reaching that $350 mark, which gets you a beautiful Chicago Blood Cancer Out for Blood jersey. But the Out for Blood team is out to cure blood cancer, so we're going to be involved in bike rides, in walks, in runs, in vampire nights out, anything that we could do to raise money and awareness for blood cancer. So, a lot of folks tune us in, and one of our viewers called us Must See Cancer TV. And when we're talking about cancer, of course, we're talking about lots of different types of diseases. And Meckler, Bolger, Tilson, and Merrick and Pearson, the Chicago law firm, is the firm that has helped sponsor this program and made this program possible. But even if you don't right now pick up on some of the things that you need to know about blood cancer, because obviously, hopefully you never need that. And until you're in tune with some of these issues, you may not need the information. But if and when you ever do, because you or someone you know or love is impacted by blood cancer, you can go to chicagobloodcancer.org and you can view any of the season 1 episodes so that you can get the information that you need. And one of the best things that we have in Chicago for people impacted by blood cancer is not only one of the top hematologists, oncologists in the country, but she's so beautiful and she's so wonderful, and she helps her patients and loves them and cares for them and gives them that special care that you really need when you get through cancer. Dr. Gregory, thank you so much for joining us.
Thank you, Scott. I love being here. It's been wonderful to be on the show with you and Charlene and to really talk about the awareness of the blood cancers. We used to be a minority in cancers, but we're continuing to increase in numbers, unfortunately. And I think a lot of that has to do with the aging population. We're all sticking around a little bit longer, and we've been exposed to a lot more than younger people have. And I think that it really affects our immune system, and that's one of the reasons why we're seeing an increase in the blood cancers.
Yeah, and it's sort of out of control because they account for about 9.5% of the cancer deaths in the U.S., and non-Hodgkin's lymphoma has nearly doubled since the 1970s, and yet it doesn't get the awareness, the attention, or the money that some of the other cancers and diseases do.
That's correct, absolutely.
And I can't think of a better guest to have to close out the season and to put things in context for us by telling us sort of where we've been, where we are, and where we're going in terms of blood cancer treatments and research. So why don't I just turn things over to you to educate our folks a little bit about that.
Well, thank you, Scott. And I always go back to remind everyone that really the treatments of cancers came out of the treatments of the blood cancers. Actually, it goes all the way back to World War I when nitrogen mustard gas was being used, and chemical warfare was in its infancy. But they actually noted that some patients that had lymphomas and swollen glands, when they were exposed to these toxic gases, the lymphoma shrunk. And over all this was pretty secret until after World War II, actually, when actually the beginnings of modern chemotherapy started. And some of these early chemicals were used to fight childhood leukemias. And it was in the late 50s and 60s, we really knew we could cure childhood leukemia. And it was from very simple drugs at that time, drugs like cyclophosphamide and methotrexate, and prednisone was always added to it. And out of that really evolved the concept of combination chemotherapy. And we also know that putting some of these drugs together may also contribute to toxicities. And so that's where we were, combining many of these chemicals, actually, and they had side effects because they didn't only kill the cancer cell, they killed the normal developing cells. That's what accounted for hair loss and low blood counts. And it wasn't until the late 80s and 90s that we started developing what we call targeted therapies. And targeted therapies are actually going in, trying to attack just the cancer cell and sparing the normal cells. And some of these targeted therapies led to what we now know as chemoimmunotherapy. And the development of the first monoclonal antibody was actually for lymphomas, and that was the drug called approved by the FDA in 1997. And the nice thing about targeted therapy is it actually asks our own immune system to come in and fight the cancer. So you're not getting that toxic hit over the head hammer that kills all cells. We're trying to just kill the cancer cells. Now, we're not quite there. We are still using chemotherapy to cure some of the cancers. And hopefully one of these days we can come up with combinations of these targeted therapies so we don't have to use the toxic agents. And I envision really a cure for a lot of the lymphomas in the future, just by putting combinations of these targeted agents together, decreasing the toxicities and the long-term complications that we actually see from curing one cancer. Sometimes we develop a second cancer from the cure.
Yeah.
So that's where we're going. Less
So-
toxic treatments, targeted treatments, and sparing the normal body.
And so, listening to you sort of give a very succinct history, chemotherapy, radiation therapy, combination chemotherapy, monoclonal antibodies, all of these treatments that are used for so many forms of cancer started with the blood cancers.
That's right. And I always like to think, well, what are the options for treating cancer? And there's always this circle of things that we use to treat cancer. And it's always been surgery, it's been radiation, it's been chemotherapy, and now it's chemoimmunotherapy. But I really want to point out that for the blood cancers, surgery is not an option. Surgery is not part of the armamentarium for blood cancers. You can't cut out the blood cancer because all the lymph nodes are connected to each other. And so even if you think you take out one big mass, those cells have already left that lymph node and they're circulating through the body. And the same thing with leukemia. Leukemia isn't a tumor that you can actually see. It's a disorder of the blood and the bone marrow. And so you can't cut that out. You need a good biopsy for the lymphomas. So that's where surgery comes in, a good piece of tissue, because we do so many tests now. There are 60 or 70 different kinds of lymphomas now. We need a lot of tissue to get the correct diagnosis.
Yeah.
And so that's, so surgery, not an option. Radiation has a very limited role in the treatment of the blood cancers. Often it's only used for the rare lymphoma that is localized, and not many of them are very localized. So we mostly use chemotherapy, and today we combine that with the immunotherapy. So chemoimmunotherapy is sort of where we are today.
And so when I started battling lymphoma 12 years ago, Rituxan just started.
That's right.
And it wasn't part of my regimen. We didn't have the radioimmunotherapies. They were just starting and about to get approved. And so now part of the treatments that everybody, or so many of the lymphomas in particular, are using, these monoclonal antibodies and Rituxan and the radioimmunotherapies that combine that with a radioactive isotope to actually not just harness an immune reaction, but go ahead and zonk or nuke those
with some
cells.
radiation, that's right. So that is a good point. So I said that radiation doesn't really have a role in the treatment of the blood cancers, but in fact, now adding radiation to one of these magic bullets, the monoclonal antibodies, it's like giving intravenous radiation, and that goes right to the tumor site. So you don't get all the side effects of external beam radiation going through the skin and the subcutaneous tissue and the fat and the muscles and hitting organs that you don't want it to hit. So
you've
very
got
good.
more
Yes.
effective treatment
Yes.
and with less side effects.
Yes.
And so it's easier, it's less punishment for us patients to have to endure to get that cure or get that remission. And that's not just, it wasn't by accident. It wasn't because of
right.
something done years ago. It was a product of a lot of hard
A
work
lot
and
of
research.
hard work. And